Woodworking takes a lot of patience.
I enjoy this.
Bob Eck is a patient guy. He patiently waited more than 30 years before he found a doctor who diagnosed his heart problem.
When it happened, I didn't know what it was, and it would be a break in my heartbeat, and usually when it happened, I would get very lightheaded and weak in my arms.
Bob had a common heart problem called atrial fibrillation. AFib affects more than 2 million people. Simply put, the condition causes one part of the heart to beat out of time with the other.
When your heart skips a beat, it gives you, it just gives you inner anxiety and concern.
Heart health experts say many people with AFib aren't bothered by symptoms. But in some instances, this irregular heartbeat can make people feel as if their heart is racing or even jumping out of their chest, and may increase the risk of stroke, heart disease, even death.
See, there were times where I fainted because you lost blood going to the brain, the pumping. And so what if that had happened? What if I was driving the car with my wife and grandchildren and had it in the car and I lost control of the car, So you're always thinking in the back of your mind, I better be careful.
The medicine Bob had taken to help manage his symptoms was no longer working.
It kept getting worse, and then it started hitting me regardless of my activity. I could be sitting here at rest, and then all of a sudden it would kick in.
This is the patient's electrical tracing, or EKG, when he's in normal or regular rhythm.
Dr. Scott Pollock is Bob's cardiologist at Florida Hospital.
Here is an EKG during atrial fibrillation where the time interval between these complexes is not regular, it's irregular. Thus, it's an erratic heartbeat.
Dr. Pollock says because of his worsening symptoms, Bob was considered a good candidate for a relatively new type of procedure called catheter ablation.
And we use graphic animation, spoken voice.
Dr. Pollock has potential patients watch a computer lesson. It helps them learn the procedure essentially uses radio frequency to block the abnormal heart rhythm. They also learn about the potential risks. This lesson is one way Dr. Pollock partners with patients like Bob.
The partnership is based on a mutual understanding of the problem. From the physician's standpoint, his responsibility is to understand whether or not the atrial fibrillation is bothering the patient, if it's interfering with the quality of his life, to effectively communicate the potential treatment options, which include no treatment to medical treatment, meaning taking drugs, to using catheter ablation.
Yeah, I like the word partner because I sense that, the partnership between the patient and the cardiologist.
You doing okay?
Doing good.
Since his ablation procedure, Bob hasn't felt his heart skipping or racing.
Okay. Take a deep breath.
While it isn't for everyone, he and his doctor are confident it was a success.
I still have that thought, well, is it going to hit again? But as every day goes by, I'm getting more and more assurance that we have conquered it, and I'm feeling much more confident, and the quality of life is improving because of it.